As published on non-detail.com.
Chinese vaccines falling flat in front of the Delta variant. Mongolia promised its people a COVID-free summer. Bahrain said they would return to normal life. The tiny island nation of Seychelles aimed to kickstart its economy. All three put their faith, at least in part, in easily accessible Chinese-made vaccines, which would allow them to roll out ambitious inoculation programs at a time when much of the world was struggling. But instead of freedom from the coronavirus, all three countries are now battling a surge in infections. When India, due to the second wave, was pushed to a situation where it no longer could supply the vaccines to the COVAX facility, China kicked off its vaccine diplomacy campaign by pledging to provide a shot that would be safe and effective at preventing severe cases of COVID-19. Less certain at the time was how successful it and other vaccines would be at curbing transmission. Now, examples from several countries suggest that the Chinese vaccines may not be very effective at preventing the spread of the virus, particularly the new variants. The experiences of those countries lay bare a harsh reality facing a post-pandemic world. The degree of recovery may depend on which vaccines governments give to their people. In Seychelles, Chile, Bahrain and Mongolia, 50 to 68% of the populations have been fully inoculated, outpacing the United States, according to Our World in Data, a data tracking project. All four ranked among the top 10 countries with the worst COVID outbreaks as recently as the week before in mid-June, according to data from the New York Times. And all four are mostly using shots made by two Chinese vaccine makers, Sinopharm and Sinovac Biotech. Jin Dongyan, a virus expert at the University of Hong Kong, said, "If the vaccines are sufficiently good, we should not see this pattern. The Chinese have a responsibility to remedy this." When we compare this with the US, which largely inoculated its citizens with the mRNA vaccines made by Pfizer and Moderna, only 10,262 SARS-CoV-2 vaccine breakthrough infections had been reported from 46 US states and territories as of April 30, 2021, while approximately 101 million persons in the United States had been fully vaccinated against COVID-19. Well, this is not the first instance. Let us look at some of the related headlines. April 30, 2020, British doctors warn some Chinese ventilators could kill if used in hospitals. The 30th of March 2020, countries reject Chinese-made equipment. A number of European governments have rejected Chinese-made equipment designed to combat the coronavirus outbreak. Thousands of testing kits and medical masks are below standard or defective, according to authorities in Spain, Turkey and the Netherlands. The Netherlands imported 600,000 masks from a Chinese company, only to find out they had about as much protective power as wearing nothing at all. Spain imported 5 million rapid test kits from a Chinese biotech firm but found their sensitivity rate was 30%. Out of every 10 known COVID-19 patients, the kits correctly diagnosed only 3. In mid-March, UK health authorities ordered 2 million do-it-yourself pinprick antibody tests for $20 million. They have the potential to be a total game changer, said Prime Minister Boris Johnson. They weren't. The tests didn't work. Australia, the Czech Republic, Slovakia and Turkey have encountered similar problems. The 21st of April 2020 test kits for the detection and surveillance of COVID-19 cases in India that have apparently been found faulty had been procured by the Indian Council of Medical Research from China from Chinese vendors approved by Chinese authorities, a senior government official said. So, when it is Chinese, as once President Ronald Reagan said,
Trust but verify.